Chaya madam, you may start now.
Okay. Good evening, everyone. Hope I'm audible. Today, I'm
Yeah.
very honored that. Sorry. Ji. Today, I'm very honored to introduce our speaker of the day, Dr. Rohit Tanki. He's with us. He's CTO and data scientist in Datamax Wolfworks from Germany. He is research scientist with over 5 years of industrial experience in the development of AI-powered software as medical device, complemented by more than 12 years of research expertise in advanced technologies like computer vision, artificial intelligence, medical data analysis, Internet of Medical Things, data security, and signal processing. Additionally, he has a solid academics background and over 3 years of teaching experience in engineering institutions in India. He is currently serves as a CTO and data scientist at Detmax in Wolfsburg, Germany. He previously held the head of research and development position in Prognica Labs Tech FZCO in Dubai, UAE. He worked as an consultant at the Adventure Technologies Private Limited in Bangalore, India. His educational journey includes the bachelor's in electronics and communication, a master's in communication engineering, and a doctorate in electronics and communication with a specialization in computer vision and data security. Furthermore, he has extensive experience in developing software as a medical device and technical writing complement with the medical device regulations. His experience has earned his skill in ensuring adherence in regularity standards and guidelines while developing innovation solutions for the healthcare industries. He has significantly contributed to field with over 20 technical books published by esteemed publishers like Springer, CRC Press, elsewhere. Noteworthy publications include AI Role in Haptic Healthcare, Machine Learning for Wireless Communication, Explainable Machine Learning in Medicine, and Artificial Intelligence in Breast Cancer Early Detection and Diagnosis. Moreover, he has delivered expert talks on AI application in healthcare and served as a review for reputable healthcare journals. So, thank you very much, sir, for accepting our invitation and joining us today.
Thank you, madam.
Guys, I stop my screen sharing and ask sir to please take over the charge.
Okay, madam, I can share my screen. So you can see my presentation, no?
Yes, sir, it's visible. We can see.
Okay. Yeah, yeah. So, means I start my talk on this role of AI in the detection and management of cancer and the cardiovascular disease. So, means I just means start with the agenda of this today presentation. I means give the basic information of the AI in healthcare, how AI can be useful for the cancer detection as well as the management of the cancer, and also the AI can be used in the cardiovascular disease detection and management. And also I give the some how the future in this area and what are the ethical consideration is required when we talk about the AI in this kind of deadly disease management and detection. So I just start with the means overview of these two disease. What is actually like the cancer? You know, it like word is itself is very danger word when we heard about this. It's like the leading cause of the death globally affected number of millions in the every year. And when the cardiovascular disease include the various heart and blood vessels disorders. So like these two are major disease in the world, which means cause a million of deaths in every year. So both means as a because of our modern life cycles and the lifestyles and also the genetics changes is a means cause of these two diseases in the this medical science. And there are many means loopholes, or I can say many means problem to detect and manage this kind of disease due to the various reasons. So I will be give the how AI can be useful to means detect and manage this kind of means disease. So how AI can be also improve and useful for in this disease management. So these are the means some common risk factors. Like one is the smoking, which is major risk for this both like cancers and heart disease. Then the poor diet contributing to develop means various kind of cardiovascular disease. And the physical inactivity increase the risk of the chronic conditions. So these are the means common risks which means generate this kind of disease in the human. And means many countries or the many area of the world where these are the means, factors of impact. Like I talk about the smoking, and then smoking is the one of the big factor in the European country, like the poor diets also like is a, and the physical inactivities, because in the weather like over here like all 6 months is completely cold weather, so like people are the low activity scenario. So this kind of means things or the factors affect to, or means you get disease like cancer and cardiovascular disease. These are the main factors for that. Now I start with the means introduction to the AI in healthcare, how AI can be. So first I give the basic thing. I not cover most of means the thing like deep in AI. So AI is a branch of computer science which focus to create a system to capable the task that typically require human intelligence, like than the understanding of AI technology. So now AI word is nowadays is very common. Like out of 10, 9 people are talking about AI when we talk about talk in the technology world. And it's like AI is means of the various application in the each kind of area. But I'm talking about the in healthcare. So how AI can be useful in healthcare is like is analyze the medical data and assist the healthcare professional to make the informed decision. So like I can elaborate this thing in such a way that means before this AI means people, a doctor are making the decision based on their her or his own experience about the disease or the disease study. So AI helping to analyze the data in a better way to helping the doctors to make that decision in very objective manner with the means proof or with the support with the data. So it's like AI helping in that area in the healthcare. Now, overview of the AI application in healthcare. So how AI can be used in the various applications in the healthcare. Like first, I can give the example, the predictive analytics. Like predictive analysis is analyze the means data of the some particular disease and then forecasting the patient outcome and improve the decision making process of the healthcare professionals. Then the AI can be used as a diagnostic tool, where I can say the software as a medical device. One of the example of that, like people or the companies nowadays are developing the AI-based models, which can be used as a diagnostic, make some diagnostic in various kind of means disease. One of the means thing is a cancer, where the AI is a use as a, or the AI-based software is used as a diagnostic tool, which improve the accuracy and the efficiency of the doctors, and also improve the means patient care. Then the robotic surgery, where robots can be AI power robots can be used in the surgery, that improve the means surgical procedures and reduce the means long surgery time. Uh, then the telehealth innovation, like this is the booming area I can say nowadays, because everyone's are use this kind of technology. When I talk about the telehealth applications, like which is used remote patient monitoring and virtual consultation, like you not required to go to the hospital, you can directly call the doctors and you get them in some kind of assistance in some disease. So this is the means four area where AI is used in the healthcare more frequently nowadays. Then what is the benefit and potential of AI in this medical field, or I can say healthcare? Is improve the patient outcome. Means AI helping the hospitals and the means doctors to design the particular means treatment plan based on the individual of the patient. Like right now is like all the treatment plant and everything are just generalized means homes, or this generalized means by some kind of societies. But when it is not applicable for each kind of human or the patient, so it like AI can analyze your own data of the patient and then give the some specific treatment plan to that person. So it like improve the person's or the patient outcomes. Then the cost reduction in healthcare, like it means because there are many uh, working flow in the healthcare is not defined easily. Like I can say in the European country where I'm living right now, so where the appointment is very difficult to get. So it like you have to wait for the means 2 week or 3 week to get the appointment to go to hospital. So this kind of means where you require, and also there are multiple tests is required to identify some kind of disease. That kind of means thing will be analyzed AI easily and streamline the processes in that, which reduce the cost in the healthcare system. Then they also make helping the making the support in the clinical decisions, where AI driven software is to analyze the data and helping the doctors to make the decision means with their own and her own experience. So it's like these are the area where AI has a benefit in the healthcare. Now I switch on the AI, how AI can be used in the cancer detection. So means I start with AI technology for the early detection of the cancer. So AI is used for the early detection of the cancer, where the means majorly the deep learning is used, because the most of the decision in the healthcare in the cancer detection is based on the medical image data. And researchers proven that like deep learning is one of the best AI technology, which analyze the medical image data very easily, and means is with a very good efficiency compared to the human being in some such a case like cancer. So where the means multi types of images, like I can say the mammogram, CT scan, MRI, this kind of medical images are used to diagnostic the different type of the cancers, and this helping to make the early detection of the cancer, which also helping the patient to improve their outcome. Means patient is get the decision about this cancer in early stage, and also is easy to define the treatment plan for that particular patient. So AI is used to means make this streamline or the efficient means workflow to detect cancer early. So these are the means early cancer detections, where now I give the means what are the case studies like AI is used in cancer detection. is improved accuracy. So I already give that. There are numerous case studies shows AI is effi- effectively in detect cancer through the advanced image analysis. I already means, and also AI system have demonstrated the accuracy level. That means reliable experience radiologists in tumor identification. These are the means accuracy, and you can only detect cancer using AI. Now, means I talk about the cancer detection using imaging techniques. So, like early detection is one of the curious part of the is for that any successful cancer treatment. So, AI plus advanced imaging technology enhance the diagnostic accuracy, and there are various images modality are utilized for the visualize the tumor. So, like there are various kind of image technology are used to visualize the tumor on the different kind of cancers. I give the means that all the example where this computer vision or the image plus AI can be used for the detection of the cancer. So these are the means benefit for AI in the cancer imaging. AI, hello,
Sir, you are audible.
okay, because I feel someone has just one question. That's why. So so the benefit of AI in the cancer imaging, like AI algorithm means process vast amount of data with the means rapidly, and it make the means give the improvement means detect the cancer tumor, so the cells in the images. So it is easy to make the means diagnose the cancer tumor or cells in the image, and is improve the means patient outcome. So these are the benefit of AI in the cancer imaging. Now I give the where means how the AI means plus images are used the different type of means cancer diagnostic or the detection. So first is the breast cancer diagnosis, where the mammogram are the standard for the detection of the breast cancer, where AI technology improve the means accuracy to identify the abnormality, and this is also used to find early detection. So I give them in some examples on this. I already work on this area, breast cancer detection and diagnostic. Then the lung cancer, where also like CT scan are effective for the lung cancer diagnosis, where the various kind of means CT scans are analyzed by deep learning models, and they identify some tumors and abnormality in the images, and they make the decision about the lung cancer tumor. Then the next is a brain cancer, where MRI and CT scans database and the images are used to find the breast cancer symptoms like headache, then the cognitive changes. This kind of means on also used to detect the cancer tumor in the means images. Then the skin cancer, where the using this like nowadays many tools are coming in the market, where you can means capture your screen photo and put in that tool. They means identify what kind of cancer or what kind of disease over there. So like cancer disease, where this kind of determinoscopes are used to means analyze, where also AI is coming in that kind of tools, which means helping the doctors to make decision or about the tumors and this kind of cancer types of the screen is easily identified using AI over there. Then the next, the colorectal cancer, which is one of the means where people are researchers and companies are developing the AI power endoscopic systems, which means analyze the means various kind of images on the clone, and means find the abnormality in the and the stage of the cancer, which is means in which where this AI is used. Then the cervical cancer screening, which is one of the means nowadays is a topic in the women's health means area, where means colposcopic means images plus different type of histopathologic images are used to means identify the cervical cancer cells. So AI plus AI can be used to analyze this kind of images and means give the what kind of cells or HPV is present or not. This kind of decision you can make using the AI in this area. Then the liver cancer, so you're like, oh, where also the different type of images you can feed in the AI models, and AI also use over here to identify the means this kind of cancer is a, like liver cancer is present in the image or not. Then there is thyroid cancer also, where the ultrasound is used to means identify the thyroid nodules. So using the means that kind of image database of the thyroid, you can also get the means detection of the thyroid using AI. So it's also helping to means regulate the monitoring of the nodules is for the patient management. So these are the means different means visual means the cancer which can be means detected using the vision technology, or I can say the computer vision technology plus AI. You can detect this kind of various cancers. Now I give the use cases for the cancer detection using AI and vision technology. So means I give the first is a basic means idea how you can develop the AI based breast cancer screening system. So this is the means simple diagram of that. You can see the different means stages over that. First is the triage screening, where you can means give the input of the any kind of input. This is applicable for the any kind of cancer means cancer, but I give the in context of the breast cancer. So like medical image, like you can train the means deep learning model which classify the means cancer syndromes is available or not. So I can say the normal or abnormal thing is means you first detect using that model, which is called a triage screening. Once you get the means suppose image the cancers, then you require to identify what are the syndromes or the what are the means what kind of tumor or where is the suspected means the area where the cancer probability. So for that we means the we use the detection and characterization of that area. So using the another type of means deep learning models which detect the cancer tumor, or I can say the region of interest in the image, which is doctor is also identify using their own methods nowadays. But you in AI you can feed this image, and then these trained models will give that tumor region, and then you can using the computer vision technology you can find the features of that. So that features, when you analyze that features, the features give the different type of means tumor, like I can say the benign or malignant, and also the stage of the tumor. So then you feed these features into the means this machine learning model, which means give this kind of output. So and then means once you get this thing, like what kind of tumor it is, like the benign or malignant. The benign, then there's a means I can say the early stage, or it will be it is not more dangerous, but if they are malignant, and then doctor make the means further treatment. So over also AI can be developed nowadays, where you combine the other data from the lab and the demographic information of that patient, and you can make the better decision about this screening of this breast cancer, how to treat this patient for the breast cancer. So this is a complete flow for that. Now I give the means basic example of the means how you can detect the breast cancer using the AI and mammogram. So you can see there is four images of the one patient over here, which is a different type of images like left LCC, LMLO, RCC. These are the standard mammogram images of the left and right means breast. Then you means you can see the image with the ROI extracted. So this all the images are the cancer's image. So you can see over here there means various ROI in the in over here. You can see this is ROI over here. So in the all image, you get the different type of ROI. Then using AI, we detect this ROI using AI models. Then once after that, you can see over here, that means they are identify the all the means. So you can see over here, that means tumors is identified. How many tumors in this? This is the tumor one, tumor two. So then after that, once we get this, then we means identify the features of that. So these are the features of that tumor. So this is the file of the image like LCC, where the tumor, what is a tumor one has a characteristic, this is a characteristic or the features of that tumor, and based on this information I feed in the ML model, which gives this kind of means tumor type. So this means how AI and the mammogram can be used for the breast cancer detection. The same thing is means I developed for the ultrasound images, where you can see the means this is the input means image, like which is the ultrasound image, which we used to confirm for the means tumor, what kind of tumor it is. So this is the means give the tumor in the image and also the finding of that tumor. You can see that all the size and everything, means the shape, orientation, echo pattern. These are the features or the finding is used by the medical science or the doctors to define what kind of tumor it is. So you can see the case result is a B line, and these are the information we take from the means actual machine. So these two information which is over here is been taken from the machine, and these other information are extracted after means detecting this tumor. So this means way you can means prediction you can predict the breast cancers in ultrasound image. So this means two methods mostly used in the detection of the breast cancers like mammogram and ultrasound. Then I give them in second is like AI based cervical cancer systems, how this kind of means system can be work. So like patient is coming, that various kind of tests are performing, so AI can be put in this all different ecosystems in this cervical cancers uh, screening system. So where if you have the pap smears images of that patient, you can analyze that and you generate the different type of cervical cancer cells. Also these coloscopic images where you can design the AI models which also be like HPV is present or not, and combining the cervical cancer cells plus these results and also the astrology data of the patient, you can make the prediction of that. So like it is a prediction to predict the risk level or I can the stage of the cervical cancer, and then it is compared with the means what is the previous finding of this, like I can say the screening. So like first today is means we do some screening and generate some predictive results, store it that in this, and then after 6 months is it means again same patient is come and analyze the thing and generate some predictive results over here, which compare if there are means changes is finding, then doctor maybe means see the possibility of the positive case, means there are changes in this finding of the previous finding, so they change check their possible positive their any possibility of the cervical cancer or not. So these are the this is the screening system for the cervical cancer. Then how I can give the basic some example how you can do that. Like this is a detection of the cervical cancer syndromes using AI. So which use AI means pap smears analyze a base system. So where you have to upload the pap smear images of the cervix, and you get some kind of syndromes of which is the I can superficial intermediate, like one kind of the cervical cells, which is means indicate you have some means cancers is present in that uh, the possibility of cancers. Then second is examples of the means HPV detection, like where the means I develop this thing with the help of other kind of images, which is called the coloscopic images, where when you upload the image over here using this button, and then you can press on this button, it gives the means decision about this HPV is present or not on that image. So it will make the helping doctor to decide this uh, regarding make the decision of HPV. Then third is the means histopathology, like is that all are used in the different segment of the cervical cancer, I can say. So like doctor can or means upload that histopathology image and then generate means click on this prediction about this image, you get the means like the CIL1 cells. It like the first stage of the cervical cancer. So it will give the means what kind of stage it is when you analyze this kind of image. So like there are different type of stages over there, which is means represent the cervical cancer cells like CIL1, CIL2, 3. This kind of stages of the cell is you can identify using this histopathologic image analysis. So this is the detection of the cervical cancers cells using AI. Now, what are the challenges? So, means and limitation in this area. Like first, I can say the data quality issue. Like this pure, there are no data is available, which where you can develop the AI models, which can be used in each continent or each country. So, you I mean, this is the first major challenge in this detect this kind of AI development. Then second is algorithm bias. It means the algorithm is bias can be result in flat treatment and inaccuracy prediction in AI models. It means it is a give the sometime bias in the data algorithm is give the wrong results which help means harm for the patient. Also affect means affect the patient health, or it may be cause the death. So this is one, and also the regulatory approval. So this is one of the big means point nowadays in regulatory approval, means because each country has their own regulatory means guidelines. When I'm talking about the Europe make their own AUAI Act, where I have to means compliance my AI with that act. Then I can means put in some real practice or somewhere where I can prove that this work for the human. So these are the means challenges. Now I move on to the AI in the clinic cancer management, how the AI can use in the cancer management. So it is AI-driven treatment plan. So you can personalize the treatment plan. So over here, using this AI, using this all the data which you like radiology diagnostic plus patient demographic data, you feed with the AI. AI generate the means treatment plan according to the personal's data. Then which and it's used to means uh, care the patient in the better way when the data is means analyzed for the each individual patient. It is generate the better treatment plan for the different patient of the different I can say different demographic area. Second is the personalized medicine and AI. So like I already said, like this describe the targeted therapies. Like there are various therapies is used in the cancer management, which is called as a cancer rehabilitation, where you have to design some kind of exercise or some kind of educative material for the cancer patient to deal with the cancers uh, procedure during cancer treatment procedure. So that you can design using AI. And also you improve the treatment effectiveness, means it helping to personalize the medicine for the each patient. It's helping the patient to improve their outcomes, or it helping patient to get their recovery very fast. These are the area where AI can be used in the cancer management. Then monitoring and follow-up using AI, like continuous patient monitoring. So you can using the means various kind of variable technology nowadays we use to means you can monitor your cancer patient health if there is any changes happening in the body, like I can say the monitoring of the pulse or monitoring of the blood pressures. This kind of data you can means, collect using variable technology. You can send to the uh, hospitals, or so doctor can make the decision if there is anything happen wrongly. So and it also helping to make the decision timely, and it also helping in the improve the long term means outcome, like because the cancer treatment is a very long process in some cases. So this where AI can be used to manage this thing with the limited resources. Then this is a telemedicine and remote care, cancer care. So where vision technology enables the remote consultation for the cancer patient, where patient can submit images for the evolution from home, which means which is also used in the rural area. Like I know one of the means app in the Europe, which is called the Derminologist, where you can means upload your skin images. They means give the complete diagnostic of the skin, if you have the cancer or not, or if what kind of symptoms over there. This all the information you can get. So that telemedicine can be used for the cancer's care and management. So these are the area where means AI can be used in the management of the cancer. Now I next is my point is I try to cover is AI in the cardiovascular disease detection. So over here, AI is used to means detect different type of means disease, like data processing in then the risk assessment. You can find cardiovascular which more accurate and improve the diagnose and preventing measurement. So it also helping to means make the prevent measurement at the risk individual. So it is like it is different disease in the cardiovascular where you can use AI to improve that decision making of the doctors. So like where means what kind of diagnostic tool where AI can be useful. So one is ECG image analysis software, where you can enable AI with this kind of ECG signals means collected tools, and then AI can be detect the means what are the cardiovascular condition abnormalities present in the patient. So AI can directly give that decision without means more I can say the improve the decision making of the doctors. Then imaging systems like various cardiovascular means disease can be diagnostic using MRI and CT scans, and where AI can be also used for that, and is helping to make the timely treatment, which improve the diagnostic accuracy on that. So it is means I already means discussed that same thing. It like it is applicable over here, like it is a use to means improve the accuracy of the cardiovascular diseases, because all the AI based system are means based on the data which kind of disease you want to manage or you have to detect. So in the cardiovascular, I can say one is the you have to predict the heart rate of any person, how means heart rate is fluctuating. This kind of prediction you can make using AI by analyze the data of that patient. Now the how AI means in the this kind of cardiovascular disease management. So it means it's the same thing which is used in the like cancers. You can use the same thing in the this kind in the cardiovascular disease management. AI can be used to define a personalized treatment plan based on the patient data, and is make the data driven decision, means is helping to make the decision with the means help of the data analysis. Like doctor can analyze that uh, data means help with the help of AI. They make them means some treatment plan, which is means based on the data which they receive from the patient. So this is one means area. Second is the remote monitoring and the means telemedicine. The same thing is applicable over here. That means only the data of this disease are different. Like I'm saying about the heart risk prediction. So where the heart rate means data is collected by the wearable devices and that's sent to the AI models with the or the hospital where this AI can be help to make the analyze that signals and make some decision for the doctors. These are the means remote monitoring and telemedicine's area where AI can be useful. And using this means how AI can be means is improving the patient outcomes. So like using AI effectively management strategy, like you can using AI means you can or the hospitals or the doctor can design individual patient need or the plan and is improve the means treat healthcare systems outcomes and also improve the accuracy in terms of the decision making and also helping the patient to improve their recovery. So these are the means main point where AI can be used in improving the patient outcomes. And then this means what are the future direction and ethical consideration, because like there these are the future trends like advance in machine learning, because you like in the you have to learn continuous learning your model to make these diagnostic and predictive tools more accurate to means improve the patient outcomes or improve the recovery of patients. This means also the data analytics in healthcare. Up to this, there is no AI kind of means thing is available in the healthcare because doctor make their own decision based on their her or his own experience. So where AI is used to means come useful to these doctors to make their decision and improve the treatment plans and outcomes, etc., and also use in the early detection of the cancer. Then personalized medicine is a new term is coming in the market, like where up to this point every medicine the personalized medicine is a new term is coming, or I can say now also one new term is coming at digital medicines. There are two new terms are coming. So these personalized medicine means the medicine which is designed only for the particular patient. So AI helping to make the means this kind of medicine prescriptions for the each patient, because up to this every like they doctors prescribe the standard medicines for the each patient, but based on now analyze the patient data you can means give the specific medicine to the specific patient. It's not like generalized medicines. So this is the means new thing is coming now, that this ethical implementations of AI in the medicine. So like this bias in AI systems, it like you train your AI for some specific reason. So this means cannot be applicable or other kind of means area. So it no, means it's unequal treatment outcome for that patient. So like it is bias in the system and accountability issue. Like many countries or many doctors are not easy to means uh, adapt these kind of changes. So it like this is the issue of the acceptability of this kind of means technology and also the laws of human touch. So integration of AI in medicine may lead the you means connection between the healthcare provider and patient. So these are means there are some implication of AI in the medicine or I can say the healthcare. And this is one of the big issue in the when we talk about the AI, ensuring the privacy and data security, which is major hurdle means I can say major point in the Western country like Europe and US, where there are strong data regulatory, where you have to must define how the patient data you can access from the hospitals, which is one of the major thing in the US and Europe. And the regulatory compliance is where you have to means prove that your AI or your AI systems are provide good results accuracy with ensuring the privacy and security of the healthcare data. So these are the three points you have to consider when you develop any AI systems for the cancer or the any kind of disease management and detection. And these are my conclusion on that. Means AI can use in disease detection. It means it can be used for the detection of cancer and cardiovascular disease, or it can also use in the various kind of other diseases also. It all improve the patient outcome. And ethical, you require the ethical and security consideration when you develop this kind of AI technology. So these are my conclusion on these talks. And now, if you want to read more about that, you can read these books where I mentioned many points on this, how AI can be used in, or how explainable AI can be used in this area. So these are the few books. And now I am open for the question and answer if you guys any.
Thank you very much, sir. Our participants had asked few questions. They are in the chat box.
1 minute, ma'am.
Ji, sir. Sir, one is what is the mechanism for detection for tumor or lung cancer?
So mechanism is first start with the data. Like you have to require the data of the lung cancer. Like I can say the X-ray images for the chest. Then once you get that data, you have to sit with the radiologists who know how to what are the tumors in this. Because you, as a technical guy, I cannot make any decision without the knowledge of this kind of image. So you have to label the data in all that data which you get. Once you label that data, then you can develop your own AI on that. And what kind of output you want. Also, you have to define. Like lung cancer, you only want to detect a tumor. Then you have to also require the ground truth of that images also, and develop AI based on that.
Sir, next is Professor Snethil Kumar wants to know that breast tissue can be either shaped or unshaped depending on the individual and the stage of the development. How can you tell that is the breast cancer?
So that we identify the features of that. There means various features of the tissue, which is means identify or in the by right in the American Radiology Society. So we just identify that features from that area of the tumor, and based on that features, we make the decision.
Sir, I think
So
it
it's
is
like
mentioned on 27th slide. So, how one can detect it early?
some means then old means early detection means I just right now suppose upload the image, you get this information, and it means you don't know is it like image is a cancer or not. So this is the detection, early detection, like that.
Same Snithil Kumar wants to know. Sir, you can unmute yourself and ask the question and go ahead, or I read the question for you. Sir wants to know that the deep learning algorithm can be used to analyze the mammograph images and detect the breast cancer. This algorithm can be trained to detect abnormalities such as tumors and this. So, can you how this tissues are different? This is Sir's query.
So means it depend on the data. Like she asking means he asking about the tumors, calcifications, architecture disorder. So they means they all are means I can say calcification. You not require AI also for that. You can do only with the computer vision technology. There are already means some technology available in the literature. You can use that and identify that area in the tumors and breast images. So in mammogram, like these model, each model has their own functionality. When I talk about the tumor detection, then my model will be only work for the tumor. It not means identify the any or abnormality, because I don't have the data on that. So it like you have to combine different kind of models to means define the conclusive output. When I say like this kind of tumor calcification architecture disorder, so you require this kind of data first to means understand how your what you want as an output. Like you want normal breast is tissue as output or abnormal. Now this is the first step. Then abnormal, you have to require this kind of data which show the tumor and that all the things.
Miss Srilekha wants to know that is any after effects of treatment can cause pain or basic symptoms associated. Are there any symptoms associated or any AI methods to identify that as and how much it is accurate?
So means this question, as a means technical person, I cannot give means this question, but you can do the pain and the other syndromes identification using AI.
Snithil Kumar wants to ask, sir, can you can unmute yourself and ask the question? Hemangiri ma'am, do you want to ask? Please unmute yourself and go ahead, ma'am.
Hello,
Yes, ma'am.
sir. Means what are the different ethical sources from where we can get data set to predict the early chances of the breast cancer on the basis of the person's habits and demographics?
Mm, for that means for that you have to ask the I can say in India you have to ask the local doctors first of all to get the data. But in means because I'm in Europe, so in Europe they have different database where you have to register yourself as a means like I'm in Germany. So in Germany some database is only for the German nationals can access that with the specific channels. Like I get the funding from European Union and then I approach that database systems and they can provide me that data because I already means try to access some data from the US where means I'm not the US citizen, so I not get the permission from that data to access from US. So this is the means major hurdle. So that means each continent, each country, their own means rules and regulations over here. Even means in Germany means Europe, you even my own data I cannot access from the healthcare system. I have to means write my doctors to give me that data if I want. This is means a different thing in different means continent. So you have to means talk with the doctors or the local hospitals where this guy means this kind of, or you can search from the publicly available data portals like IEEE data ports or some other means means data based systems where you can get.
Sir, actually, problem is that in the public data sets, we get the images and the videos of the MRI and the mammographies, but don't get any demographics of the user.
So means that's why you have to means then you have to approach the means proper way. Na? You have to means make the consent and everything because when you collect any medical data, you have to write means as a patient I have to give the consent, which means my data will be used for the research purpose. If I not give that consent, then no your hospital will be share data with any researcher. This is means standard clinical means norms in the worldwide. So how they collect the data and how they put in the public domain, which is based on the how procedure they collect. Means do during data collection. If they means not make the consent sign, no one put that demographic data on the public domain.
So, Rohit, can we use thermal imaging for the breast cancer detection also?
Yes, means there is a one company in Bangalore, Niramai. They already means get C certificate and FDA on that.
Yeah, one of the speaker from Niramai was there on the first day.
Yeah.
But is it accurate like the normal breast cancer detection technique?
No, no, sir. It will depend on the means temperature of the body. So, like in that can be means different in each continent. Like I'm in Europe, so in Europe you not easy to get the temperature because over is almost 0 degree. So difficult to means if my body is very cold, then it's difficult. When I do the same means screening in the hot temperature like India, it gives the different results. So so this means not accurate. We hope means this is that's why it's like this kind of temperature based systems are questionable in the worldwide. Like you can work in certain region, but it not be working everywhere. Like in mammogram, like AI means I train with the AI. Suppose with the India means so in India, we can use the model cannot be used for the European people. This is the means you have to train your model for each continent.
Okay, Ruchi, what is the question?
Sir, one of the participants wants to know what are the freely available libraries for the cardiovascular system defects identification in worldwide and in India, and which particularly you are using.
So means it will depend on the I can say the depend on the various use cases. What you want to do first of all. So I can show some database if you want to know. Means I have some database on that which I downloaded from the public domain, which is a maybe I can share the link with you if you want. One minute, I can.
Ruchi ma'am, if you want to ask, you can post your
Means I
question in
can.
the chat box or unmute yourself. Ji sir.
So means these are the few database you can see over here. Which means one is the like COVID. Everyone's know the COVID database is like one of the database you can call as a cardiovascular disease. So this is one database. Then the means the cardio means train like these are the database which is used to the cardiology means when I do the some cardio exercise or something, it is also generate some kind of data which helping to make the decision about the health or like hard related means decision. So it's like how you collect the data. Like there are other kind of data which means you see this is the data which means make the decision about this kind of mean disease. So it's like there are different means data like you see over here they are also provide the means demographics. So where the collects data is collected and what kind of means output you want, you get that means from the various database. So these are the few database. Then also people are I mean some researchers are also using the means detect the means database which is used to means identify the means kettles cardiovascular means pattern using the ear means eyes retinal images to identify the means cardiovascular disease in the animals. This database is funded is get the fund in the Turkey. Means they are doing some research on some problem identification in the Turkey, and they means generated this database. So there are various database. There heart failure prediction you can make, which is like pacemaker people are using nowadays. So pacemaker is generated data, which means data is feed in the AI models, which make the means decision early. Like it means send the SOS signal to the doctor if something is happening badly or something will be changed in your body. So these kind of means use cases is defined based on this all the data. So there are also some challenges on this. where you can means use this kind of database, which means available in the publicly available means domain. So this is a few database in this cardiovascular means area.
Professor,
Yeah,
myself, Dr. S. Sendil Kumar, I only ask a lot of questions to you. In cardiovascular
yes,
system, a lot of diseases is there. Each different parts, valves, lot of different functions also there. Each
yeah.
type of valves and function, each type of diseases having different type of databases, or we need to take photograph. You are telling previous your slides. You are giving lot of information about this AI give MRI scan, ECG, and deep learning algorithm to predict the particular diseases in cardiovascular disease having different libraries or having using a image only.
So means when I talk about the means actual application, when I want to put in the hospital, one parameter net cannot be used for that. You require all the parameters. Like I require the laboratory data, I require the demographic data, plus I require images. What kind of means all the kind of means thing I require to make the any decision. When I talk about the actual product or actual software which can be used in the healthcare, like a research point of view, I can say only one images. I can say image analysis. I develop one means model. So it predict one output out of like I make for the decision making. Doctor use the 5 to 6 data point. So I generate one data point. Now 5 data point. You require 5 different models. So you require 6 model. We generate the 6 data point which similar to the doctor make the decision. Then you can means top of that you put another models. Then it gives them means actual healthcare like which work as a doctor. It's not
Okay,
like
okay.
simple, complex, the very complex system in the healthcare.
Yes, yes, it's a very complex system in cardiovascular system. It is
Yeah.
possible to
He,
collaborate with you, or can I? I am also working as cardiovascular system. That's why I'm asking. Here is
Mhm.
not no sources available in India and freely not freely available. You are showing some freely available software also. And the previous lecture also, Madam gave a lot of deep learning algorithms for cardiovascular system. Europe, that person also from Europe only. That's why I'm
Yeah,
asking,
because
it is possible to get data from Europe? What is the procedure to
no,
get the data?
because in Europe, like this is the very strengthened area in terms of data. Like it is a very because of that we also stop our two project in the means because we collect the data from India to bring in Europe is also difficult. Like we are Indians, so we have contact in Indian hospitals. So once we develop that thing for the commercial purpose, like develop some software, like over here, I cannot bring the Indian data because I cannot means I generate my AI in the Europe,
Okay.
and so I have to use the European data, and
Okay.
I cannot share my data to India because I am in GDPR. So in as per the GDPR, no European citizen or European residents can set data without consent to the other world or other continent. These are means basic rules over here. So
Okay.
everything is very strict. Like even I want to do the data analysis, I have to sit in the hospital and I have to do. I'm not doing my own laptop even
So
that data
here,
analysis.
here ICMR DHR fellowship is there for India to go collaborated with any other country scientist. If I applied
Yeah.
means I can come over here and work with European data. It is possible.
Yeah, means there means many European for means a project is going on over here. You have to search for that, and means because we are the startup, so it like startup has their commercial point of view. So
Okay. Okay.
like you can have to contact the hospital means hospital clinic which is called over here, where like our research institute in India, like that kind of means research institute over here. You can contact the professors over there. Means they are also doing some kind of means this research because over here the research is like I can say the industrial oriented. Like they make the research which can be used in future as a product for some kind of industry.
Another
Like
one
maybe
question, professor. Here, there peoples are using freely available data and then producing lot of research paper. But it will they are modifying small variations and then publishing. The original
That means
Europe and all, US and UK and all, they are producing data their own country itself and doing the process.
no,
Once
means over here is like that. Means suppose I want to develop some product, I have to make the collaboration with the hospitals. So I get the data, and the hospital and my means entity has make the contract in such a way that after this research will be become this product, some name of that product or some kind of software, so that both are get the financial benefit out of that. So every
for
means over here
one
is looking like that.
small basic question: if deep learning algorithm, how much data set we required, how much image required for one data sets?
It depend. Like I can generate the deep learning model using 100 image.
Oh,
If I have the good data of means that 100 different patient data, I can develop very good model of that. Or I can means if I get the means when I get more data, more variety in data, it give more accuracy or more I can say more credibility on their model.
okay, Professor.
Actually,
Thank you very much, Professor, for your nice session and conversation. Thank you
thank
very
you,
much, Professor.
thank you.
Participants, do you have any other queries, any other questions? Okay, so we are at the end of the session.
Uh, there's a one hand raised by
Ruchi ma'am, you want to ask anything? Viral Parmar sir, you want to ask anything or want to put a question in a chat box? No, I'm not receiving any response. Sir, if you stop sharing screen, I want
yeah.
to share my screen.
Yes, ma'am. That means few hand raised
Yeah,
still.
still knowing. Manoj Palji, Viral Parmar, your hands is raised. Do you have any questions? So I
No,
think
ma'am.
we are
No,
at,
no, 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 ma'am.
okay. See, I think we are at the end of the session. Hope my screen is visible to you.
Yes, it is visible.
Yeah. Thank you very much. Sir, as a token of gratitude, I would like from our the organizing team, I would like to represent e-momento to you for delivering this session and being with us. Thank you very
Thank you,
much, sir.
madam.
Ji, thank you very much, sir.
Thank you, madam.
Madam, we can take one group photo
Ji,
with all the participants.
I request all the participants to please turn on your camera and we would like to have one group photo with the our speaker.
So, Rohit, one last question from my end. Is there any
Yes, sir.
opportunity for tie-up between your organization from the India?
Sir, we all means already make the MOU with the Marwadi
Okay.
University. So it's a possibility. Like means right now we are means because we are a startup, so we are in the process of incorporate. So once we incorporate, we can make that means MOU and that thing.
Okay, so we can have a same MOU between Sarvajanik University and uh, your firm.
Yeah. Because
Okay,
right now means we are in the process of that. So it like once we finalize that, so it's like difficult not we will make the two times that same thing. That's why.
okay, but is it completed for Marwadi University?
Yeah, means because where we make the means previous firm. So like we mentioned that we are the means R&D group in this company. Now we want to means separate our thing from that because there are some thing is going on in Germany. You know, the automotive industry is very badly in Germany nowadays. It like
Mhm.
they means almost close in the many plant in Germany. So our investor from that area. So we try to move from that and separate our entity and make the means because healthcare is a different thing over here. It's a innovation and R&D actually, where you get a lot of fundings from the European Commission because they have digitalized everything. There's no digitalization in the Germany even. Everything in paper right now. Like they're very,
Okay,
very end of India is very advanced in terms of that.
okay.
Yeah.
So like that, grass is greener on other side.
Yes, sir. Means it like that. Means I can say we people are developing digitalization for these European people actually.
Mhm.
Most of Indians are in IT and they are developing these all the systems because everything in paper, there's no even I want to go in any hospital, I have to call them by phone. There's no any online system or there's no nothing. Everything in paper. I have to
Okay,
even go physically or ask them if you have appointment for or it is not means they say like many cases there are 2 months you have to wait for the simple diagnostic over here.
okay. Let's see that in future how we can do the collaboration in this way. And
Yes, sir.
another way, if you want to do the global collaboration, then obviously we have platform of IEEE, so that obviously in Germany it's the same platform. So
Yeah.
it is simple to do the to sign the MOU in that way because CAT has also IEEE SB. So that way
Yes,
also
yes.
we can sign an MOU.
Yeah.
So in either way we can have a collaboration directly
Yes,
between
sir.
university and issue or directly through this route.
Yeah, you know me, sir. Even if we can do it means without MOU, we can do that.
Yeah, we
There's no
can do, but
issue.
I am thinking for the benefits of researcher and students for my
Yes,
university.
yes, sure, sir.
And yeah, I know that I know your nature and work.
Yes, sir.
Is anyone has some query related to research collaboration with Rohit sir? Then it is good chance to discuss.
Means I'm available in every portal. You can contact me in LinkedIn, means in the IEEE portal, everywhere.
Okay, our next speaker is also available now with us, Akbar Doctor, and
Yes, sir. Next speaker is available.
so,
Welcome, Dr.
yeah,
Akbar.
yeah.
Okay.
So before leaving that, thanks Rohit for good speech and good work, sharing of the good work.
Yes, sir.
Thank you, Dr. Rohit.
Thank
Thank
you,
you, Rohit,
madam.
sir. Yeah. I'm taking some time to share my screen. Give me a moment. Hope you can view my screen.
Yes.
Good evening, everyone. Uh, I'm taking this privilege as I'm honored to introduce our esteemed speaker for the today, Dr. Akbar, who is currently serving as principal engineer in Fresenius Medical Care North America with over 15 years of experience in medical device industry. Mr. Doctor has made significant contributions in developing and validating automated test and calibration system for kidney dialysis equipments. His expertise lie in integrating AI-driven solutions into healthcare, particularly by deploying AI agents for troubleshooting and predictive maintenance to prevent field failures. Mr. Doctor holds a Bachelor of Engineering in Electronics and Communication from Sarvajanik College of Engineering and Technology, Surat. Master of Science in Computer Science from Georgia Institutes of Technology. Beyond his industry expertise, he has actively contributed to academia by sharing his knowledge in AI driven healthcare, including participation in AICT sponsored faculty development programs. Today, we are privileged to have him with us as he speaks on very crucial emerging topic AI and peritoneal dialysis. His insights will undoubtedly provide us with the deeper understanding of how artificial intelligence is revolutionizing the peritoneal dialysis and improving patients' care. So, on behalf of everyone, I sincere thank you, sir, for accepting our invitation for the Atal online 6-day faculty development program. And thank you for being us with us. So, I hand over to you this session. Thank you very much, sir. By this, I stop sharing my screen and I hand over to the sir.
Yeah, thank you, Chaya, ma'am. I appreciate that. Can you do everyone hear me okay?
Yes, yes.
Okay, perfect, perfect. So let me share my screen and give me 1 second. Do I have the rights? Yeah, I have the rights. Okay. Yes, so good evening, everyone. I'm Upper, and thank you, Chirag sir, and everyone for this amazing opportunity. And a nice introduction. I'm basically an alumni of SCET and have studied under Chirag sir, Vanna ma'am, Sarosh sir, Malin sir, Nehal ma'am. I don't know if they are here, Nitin sir, but I appreciate all the knowledge and everything which they have shared. Do you see my screen right now?
Yes, yes.
Okay.
You can make it full screen.
Yes, sir. Visible.
Okay. Yeah, I'll get started then. Okay. Okay. So today's topic, which I wanted to present to you, is about how we have employed AI in one of our peritoneal dialysis machines and how we are helping patients to get a little better. And let me just do one thing. I think I have a little. Should not make it automatic. I'm sorry, I just have to change this settings. I forgot in the transitions, I guess. So it was. Yeah. Sorry about that. Let me do this. Okay. So let's come back. I just today what I'm trying to present to you is about how we have used AI in our peritoneal dialysis machines and how we are trying to make our patients' life better. Right. So I will. The way I want to do it is that I just want to give you a little basics about what our company is, Fresenius Medical Care, and then what peritoneal dialysis is and what are the different kind of dialysis treatments which people go through. Some of you might have, unfortunately, some of your friends or your family members who may be going through this treatment. So just give you a basic understanding of that. And then what are the problems which we have with this kind of dialysis treatments when we do it in the peritoneal way, and how we have tried to employ AI to make the patient's life better, right? So I would just go through that implementation, what we have done, and then I would love to take some questions and suggestions from you at the end, because it's still an evolving work for us. We have produced some results, but at the same time, we are looking for some challenges and some future work to make it better. Yeah. So first, just to give you a brief about Fresenius Medical Care. So Fresenius is basically a German company. Yeah. When I was a student in Germany and doing my master's in biomedical engineering, I had some friends working there, and what I knew of Fresenius was it is a very old company. If you look it up, it was an apothek, as they call it, pharmacy in Deutsch, in German. It started way back, and then slowly and gradually it evolved into a dialysis offering company. And today it has around 90% market share in hemodialysis and 38% market share in the whole world. And it may not be very famous as Google and Apple, but it's a dialysis company and has around 124,000 employees worldwide. And I work for the first SBU, the strategic business unit as we call it. It's called Fresenius Medical Care. And I work in the California region in the North America, where we build and we develop dialysis machines, both HD, which we call hemodialysis, as well as PD, as we call it, peritoneal dialysis. And it has another different SBUs as well. We have Fresenius Kabi also in India, doing pharmaceutical drugs. And then we have Fresenius Helios and Vamed, which is another SBU which takes care of hospitals and does other stuffs under Fresenius umbrella. Yeah. So the first thing which we have to understand is that there are two kinds of dialysis in the world, right? We have hemodialysis treatment basically, and the other one is the peritoneal dialysis. So the machine which you see on the top out here on the right is the dialysis machine which we sell. We call it 5008X machine. And I think some of you might have gone through this already. Dialysis is basically, in a very simple term, it's nothing but it's a reverse osmosis process. So you have the patient, as you see here, between 13 and 12. You get a fistula surgery when you want to do hemodialysis, and you take the patient's blood out on this number 12. It has a lot of nuts and bolts, a very complicated machine with a lot of sensors to detect bubbles in the blood, to maintain the temperature of the blood. But in simple words, it takes the machines and then goes to a dialyzer, which is at number 9. That's where the hemodialysis actual action happens, which is the reverse osmosis. It sucks different fluids, especially urea and other impurities, as well as water from the blood. And on the other side, which is the blue part of this dialysis, is nothing but the dialysate fluid, which is having a special concentration of salts and water, so that it is having less salts and less water compared to your blood. So because of the membrane reverse osmosis, you will be able to take the water and salts out of the patient's body, as his or her kidney is not able to do so. And this happens over a 4-hour process, every 2 or every 3 days, depends on your prescription, depending on your lifestyle and how much your kidney is functioning. And a patient will have to either go to a hospital or a clinic, or if he is extremely rich, he might have a dialysis machine by his bedside at home, and some nurse or he himself would be doing this, right? So this is the hemodialysis. And in this, you take the entire blood of the patient out over a 4-hour treatment, and you are able to recirculate it and purify it following this simple process. Yeah. The second kind of dialysis which we want to talk about today is the peritoneal dialysis. So peritoneum, as we call it, it is nothing but our complete sac, the abdomen sac in which you have all the organs, as you see on the screen on the right. It has got the kidneys, it has got your intestine, your bladder, everything else. And those entire tissue holds the entire, all of these organs together, is called peritoneum. Now, how we would work, how we want to use this as this membrane, the way we use in hemodialysis, we have an external membrane where we put the blood on one side and we put the dialysate fluid on the other side. And then you have the reverse osmosis, right? Where the impurities and in the blood and the water is sucked out. We want to use our own peritoneum in our body to work as a membrane, so that we can get the fluids and the water from our body out on a regular basis, like our kidney would do. So what we do is, it's in a very simple block diagrammatic way, is you have the dialysate fluid on the top. You have a mechanism in which you push this fluid inside your peritoneum. So basically, inside your belly, you get the entire water and get stored inside your belly for the whole night. Then at night, because your peritoneum is also a membrane, it can work as a semi-permeable membrane. It will allow the different impurities, urea and different salts, as well as water, which is in high concentration in your body, to push out to the dialysate. Because the dialysate is almost pure water with some salts in it. So it has got very less concentration of salts. It will be able to suck those salts out of your veins and your blood, and will be absorbing it inside. So the whole night, this water stays inside your belly, and the surrounding veins and arteries which are around the peritoneum, where the blood flows naturally because of your heart, it keeps on putting out different salts and water inside this dialysate. So at the end of the night, after an 8-hour treatment, your dialysate, which was almost pure water with some salts inside your belly, would become like a urine, as you see on the right hand side, right? And then in the morning, you suck that out with a pump, and put it in the drainage bag. So what happens is the kidney action, which should happen normally in a normal person's or a human's body, is done artificially with this dialysis treatment, which is different than hemodialysis. Here, you don't have to take the whole blood out. You don't have to sit for 4 hours in front of the machine. You just have to have an incision near your navel, which is done only once during the starting of the treatment when you are a dialysis patient. You just connect your tubes, your blood lines from the machine, and then you can go to sleep. And then the machine itself will take care of pushing the water inside your body. It will also take care of the rate, your temperature. It will measure your temperature of the body so that it will bring the temperature of the fluid same as the temperature of your dialysis fluid, because otherwise, yeah, if you put cold water inside, your body may not be very comfortable. So all those actions are taken care by the machine. But in simple words, you push the water inside your body, wait for 8 hours, and then push it out with the urine. So you are done for the whole night, and morning you can go to work and enjoy your life as you do with a working kidney. So this peritoneal dialysis has got two different types. One is called CAPD, which is continuous ambulatory peritoneal dialysis, and another one is automated peritoneal dialysis. So Fresenius does not provide at this point of time CAPD. CAPD is a very manual process where you have a machine. You go to a machine 3 to 5 times a day, depending on your how much hard work you do, so that how much urea you generate, how much impurities you generate. Depending on that, you go to the machine, you connect, and you have to do it manually. You have to manually push the water inside and then manually push the water out. The other part which we offer as Fresenius is APD, which is automated peritoneal dialysis, in which we sell a machine. As I told you, the machine has got this bag of water. It has got some membranes inside, has got a pump, has got compressors. All of that unanimously work to push the water inside automatically while you are sleeping at night, and then takes care, makes sure that it is inside for almost 8 hours, and then pushes the water out. And this is called APD. That is what we sell at this point of time. So the benefits, as you can see, is pretty high, because in terms of hemodialysis, a patient will have to go to clinic. It is very expensive. You need a dialyzer. You need to buy also blood lines. You need to be around mostly a nurse, because she will be connecting to your fistula, the blood lines, taking it out, making sure you are comfortable, and so on and so forth. And it is a high cost associated with it in the Western world. At the same time, if you look at peritoneal dialysis, it happens at home. Even if you are extremely old and you don't have cognitive abilities to connect the bloodlines, then you might need a little help. Otherwise, you yourself are able to manage it. Just connect, press a button, and the machine takes care of it. And there is no exchange of blood, so there is very little chance of infections. And also, although there is some chance of peritonitis, because you have this incision created, but a doctor will be able to manage it with some antibiotics and regular monitoring of your blood, right? So this PD gives you a lot of freedom. You can travel. You don't have to go anywhere in the morning and spend 4 hours every 2 days. You can do your work, be a professor or an engineer or a doctor yourself, and just come back home at night. Just connect the blood lines, start the machine, go to sleep. In the morning, you are finished with your dialysis, and you don't have your urine flowing inside your blood. So much better lifestyle, right? So this is the machine which we sell. It's called Liberty Select, which we sell in North America. We have a similar machine which we sell in EMEA region, in Germany, everywhere, and also in Southeast Asia. But this is the one which we sell in the US. And this machine is the one which takes care of whatever I told you right now. Now, there's a small problem in this peritoneal dialysis arena, that you do this at night, right? You connect your blood lines, you go to sleep, and sleep is a very important part of your life. Without sleep, you cannot function normally as you would, right? If you're not able to sleep the whole night because of some noise or any other stuff, then you won't be able to perform in the morning, and you will have a very bad patient experience, and your life and I would say, your well-being will decline. So noise is very, very, very crucial to make sure that this noise is below minus 40 dB, right? Now, this machine comes with bunch of equipments, and it does make noise. So what we try to do is that over lifetime of this machine, once the machine has been deployed at a patient's home, we wanted to monitor that if the machine now is going to make noise, we should be able to predict that. And when that happens, we want to swap out the equipment. We should be able to send a new equipment to the patient and get this back in our factory, so that the patient does not have to call us, will not have sleepless nights because of the noise of the machine, and we should be able to predict that. That's the main problem statement here. Now, we need to find noise, right? Noise is very, very subjective. Just to give you an example, like I grew up, Chirag sir and everyone knows me. I grew up in Surat. I've lived in Bhula Modi Seri and for like entire life, right? And in Surat and in the entire India, we have a different culture as compared to the West, right? In where you when you go to bed, you still have some cars beeping or some bikes beeping, and we honk very easily in India, right? It's a very different culture than as compared to what we have in Germany or in the US. So when I myself moved to Germany at the age of 22, I just felt that it is so pretty quiet. And why? Because I wanted to hear some noise, right? And for me, it is no problem. Even right now, I go to India, I can sleep like a baby at night in my home. I don't have any problem in Begumpura. But my daughters, both of them are born here, have just been raised here. And my elder daughter, who is 8, she has not lived in India a lot, right? So whenever she goes in summer vacation, she always tells me that, Papa, it is so loud, even at 12 a.m. or 1 a.m. at night. People are still honking, and I cannot sleep. So for her, that is noise, right? And for me, that is not noise, because I don't even realize that some chagra or some rickshawala is going by and is honking. I don't have any problem with that, right? So noise is a very subjective way of looking at it. Some patients may find that grinding sound okay and sleep, some may not. So what we are focusing on is vibration, because the vibration is what we can quantify, we can measure, and that is something on which we can train a model, and we can decide whether and predict whether the machine will make more than 40 dB of noise or not, right? So we are focusing on vibration and not noise, because noise, people will be subjective, as is explained, right? So what we did was, we took a Honeywell vibration sensor, right? We connected that to different locations. We took a couple of those, connected to different areas on our machine, and that we connected to a Raspberry Pi gateway, where we just collect our data, we process that data, which I will talk to you about, and then we push that data onto the cloud. And on the Azure cloud, we have put an assembler model, which is doing all the fun predictions depending on the data gathered. And then it will tell our SAP system that, hey, patient Akbar's machine, which is at Ashwood Drive in California, is going to go bad in a week's time, because it is making the right noises, right vibrations, which it is emitting right now. So then we get our supply chain gets a notification, and they then decide that, okay, we have to go to Akbar and we have to proactively give him a new cycler and then take the old cycler back, so that he is not going to have noise at night on next Monday, and then he will not complain, and he can sleep peacefully. So this is what we did. We take the sensor data, we process it, push it to the cloud, and we use a model to kind of do the production. And the same thing, we do it also in our factory. And the reason why we should do it in our factory is that our production model is a little different. We don't always produce new machines, because the way our business model works is that we charge the patient on the treatment, not for the machine. So it's a little different. It's not like a fridge which we sell, and then you use the fridge, and then if it goes bad, you buy spare parts, and then you buy a new one. What we do is that we give them the machines, we give them the dialysate fluid, which I showed you, which goes inside your body. We give them the bloodlines, so we make money out of treatments, not on the machine. The machine is free for the patient, right? So for us, when the machine comes back, we do some sort of analysis on it, some RCAs, and then we kind of refurbish that machine. We change the compressors, the motors, membranes, things like that, and then we do a full-blown testing, and that machine is back in the market to be delivered to a patient. So in the factory also, once we have done all our changes to an incoming machine, we want to make sure that it is not going to go bad in a couple of months or weeks, so that it is a bad model, right? You bring the machine in, you do all the work, and then you go to the patient immediately in 1 week. If it starts making noise, then you don't want to swap it out again and again. So we use the same model to predict whether the vibrations are intact and are not going to give us problems or not, right? So vibrations is what we are looking for. In our PD cyclers, we call it PD cyclers, peritoneal cyclers. And our cyclers have got motors, because we have pumps to push the water in and push the water out and pull the water out. as well as we have compressors, because we need to create that transmembrane pressure, and we need to have the membrane and the cassette connected to our sensors. So we have got basically three major vibration producing elements. So, and I think we all have motors, water pumps. We know what kind of noise it can make in the morning when it's like when it's pushing water onto our tanks. These motors are smaller motors, but still they make those noise, right? So we want to keep that noise as minimum as possible, and we do have padding and stuff like that to make it more soundproof, but it does wear and tear over time. So what we do is we need to get these vibrations under normal conditions. We created an ensembler learner, right? Using random forest, very basic. I think all of you are working a lot in AI. I know I have seen Chirag's work, Nita ma'am's work, and every one of you are very well versed with different AI models, right? We used ensembler learner. We use random forest to create that ensembler learner. And what we did was we created data sets of our vibrations. So all the vibration data which we got, we tried to gather it and classify it into normal operating condition where it is very super quiet. A very new machine gets no vibrations, no problematic vibrations and noises. The second data set was with faulty motors, where we swapped it out with the motors which were already worn out. And the third one was with the faulty compressors, right? So the compressor would also has a motor and gives you the noises. And from this data, what we took out was different features, very simple features. We took the RMS of the signal, which is because the signal of vibration is against time. We took the peak to peak, we took the skewness, we also got the spectral energy and the dominant frequency. So every kind of features which we could think of, we extracted from these signals and kind of classified them in normal and problematic operating conditions. So why we chose ensemble learning, right? Ensemble learning, the main reason was that we wanted to predict accurately, right? We don't want to create a model which will not give us good accuracy and may give us 20% accuracy and may not be able to give us good data, right? But the problem with ensemble learning is that the models are very complex, right? You have a lot of random forest, you do a lot of bagging, boosting after you get the models together, and it takes a lot of processing time, right? But in our case, as I had showed you before, and let me just go back a little bit, that in our case, the processing is not in real time, right? We don't want some data coming and immediately telling the patient that, hey, you're going to have some noise. We have some time to predict, right? We take the data, we push it to the cloud, and we process it there. So we have the entire cloud capability to process this data, and we don't have to worry about the amount of time we take to process the data. So we are okay with that. You can say processing overload, right? So we chose ensemble learning because of the accuracy which we would expect from that learner. And then we would take different vibration patterns and then create this kind of different sets. So what we did was we take the data, as I said, the vibration data from our sensors, which is probably coming mostly from motors and compressors. We first get the outliers out, because we know that during some acquisition, we do get some outliers. There is some skewness, there could be some noises around from the patient. So we wanted to get the pure vibration data. So that was first part was data cleaning of data processing. Secondly, we extracted different time and frequency based features, which I talked about, very simple features like RMS, peak to peak, skewness of spectral energy and things like that. And then we labeled them as normal, faulty, and faulty compressors, right? As we would label our data sets, we labeled them as normal, and the other ones were faulty motor and faulty compressor. And we did the data split as we normally do with any AI models. We had 70% to train. Most of them were from the patients. Our entire machines are all over the US with around 325,000 dialysis patients in America, right? So we have a lot of data coming from there. We also have a lot of data at our factory after production when we do the testing, right? So we took that data and 70% was trained, and the rest was for validation and test. Now, after training this model and making sure that this model is already trained with the 70% data, we did the validation. Now, validation in terms of FDA is a little complex process. I'm not sure if everyone or all of us would appreciate that, but there is a specific validation which we have to adhere to, because FDA has their own standards, and they call it CSV, computer software validation. So we have to make sure that whatever systems or software which we deploy in the field or on the factory, it has to go through a robust validation process, and it should pass that validation. So we had to go through the same thing. We had the validation data, we had the verification data, as I showed you in the previous slide. We did the test and we kept 15% for validation. And we did go through the entire validation process where we took 60 samples of the machine, and we went through this data to show that it has got more than 99% accuracy to show the right faulty machines. Only then FDA would allow us to put this in the field as well as on our factory. So we went through that, and we got the matrix of our specificity and sensitivity, as we call it, TPR, TNR. We got the accuracy and precision, and and in the real world, we actually deployed this entire model onto the field. So the way we did was, again, just to repeat myself, you have the data collection, you have the data processing before that, so that we get the entire data extracted out and in good shape. And then we push this to MLOps, to our Azure cloud, where the entire model is running, which we have developed. And it continuously, of course, it's getting the new data, which is always, it is recalibrating itself with the new data, and it is already trained. But then it also keeps on doing the training cycles with the new data, which we generate over 1 month of time, right? And then it automatically detects these problems in the field and tells our SAP that, hey, Akbar's or Chirag's machine is going to have a problem, and then we take a decision. So to show you some results which we had got from our machines, we could, something which I'm showing you, we were able to identify the long grinding machine noise as well as short grinding machine noise, right? So the long grinding, we almost had 100% TPR. We were able to get 100% results from our model. Similarly, for true negative, also we got 95%, and the accuracy was 96%, which we expected, right? We wanted to go almost more than 90%. So even if we take 60 machines, only 2 were misidentified as broken. But from a TPR perspective, none of the bad machines were allowed to pass through. So it was 100%. So that was good for us. Similarly, we were able to get a good identification of short grinding machines. So in short grinding is the grinding noise, like which we hear from the motor, right? You may have heard in your daily life, but may not have realized it. But this is very difficult to identify if you are only listening to the machine with different noise, right? So we were able to find that out as well with the vibration data, and the accuracy was almost 93%. However, in the compressor model, so you see here everything was green, but in the compressor, we were only at 81%, because compressor is a tough cookie to crack, because it does not run like the motors would run, right? It only runs at different points of time, and then it shuts down after the pressure is created. And it can have different, you can say, intensity to run, like a very big intensity, like, and then it's quiet for a lot of time. So we feel that the model is not behaving as we should, and we were not able to still get compressor accuracy as we wanted to 90%. And we are still working on that. So if you look at the graphs, which I'm showing you right now, this is with respect to time for the motor as well as for compressor. As you can see, in 1 month's time, the long motor and the short motor kind of achieves more than 80% accuracy in no time. But the compressor is still under 80%. And that's where we are trying to get it up and change the model, trying to see, employ some methodologies, which I will talk about, to improve the model to get the compressor detection of the noise as well. So if you look at the future issues and the future challenges, one is, of course, the compressor. We need more and more training so that it can find out the problematic compressors which create noise for the patient. At the same time, we need to also make sure that the vibration data is noise-free. We have had different algorithms to make sure that we are able to extract the data, the different features which we want, but we still are open to any new data processing which we can do on the vibration data. And one thing which we are right now actively working is to employ SHAP, right? We want to understand how we will be able to understand the predictions from different features, because right now ensemble learner, if you know, it's like a black box. You train it after creating a nice hyperparameters, and then you expect the output and you test and you validate. So it's like a black box. You give your feature input and data, and you get your output. Sometimes you don't understand that which features are actually more prominent in your prediction. It could be the peak to peak value of the vibration. It could be the skewness. It could be the spectral energy. So what we are trying to do is we are trying to employ SHAP and get this data and the prediction and try to change different features on our own and understand which features are actually affecting the prediction more than the other features. And then eventually, of course, we want to do this in real time if it is possible with better processors, so that in real time we are able to do the I would say processing and can save time in the factory, because in the patient's world the data is going to the cloud, and we have enough time even by until next morning, although it does not take such huge time. It can tell us that this machine is going bad. But when we are on the factory, when we have built our machine and we make it go through this testing process with our models, we don't want to wait for 15 minutes to tell us that, hey, this machine is good or bad. We want to have it in real time with as minimum time as possible. So that's where we have to work on our processing time of the model as well. And in the end, of course, we have good predictions. Ensemble learning did work for us to find out faulty motors and compressors, a very simple concept which kind of did work for us in a way we wanted. And we have integrated MLOps, right? We have Azure as our final cloud-based solution, where our Azure is running our models out there, but we still don't have a complete integrated CI/CD process, right? We right now do some changes, we go through the validation, and then we deploy it on Azure. So it's a very manual process where our engineers are working, and we have our validation team, quality team doing the validation, and then we deploy it. But we want to make it a streamline, like Akbar pushes a change onto the model, and then we should have an automated test and validation process on Azure, and then it should be able to build and change the model in real time. So we are trying to do the continuous integration and deployment process with Azure right now. That will make our life much more simpler, and we're able to change our models and make it better eventually for prediction. So that's pretty much it. We are trying to make a life better for the patient, so that he or she can sleep better in life and can do the entire peritoneal dialysis without any noise and lack of sleep, right? So that's pretty much what I wanted to share from my side. Does it make sense, everyone?
Participants, if you are having any query, can please unmute yourself and ask. Dr. Akbar, I want to ask that how long it has been you are in these, and so as I want to know, because as over a period of time, 3 years, 4 years, otherwise also the patient who are dialytic tends to face the degradation in the health. So whether the degradation in the health because of this treatment or the regular treatment, how one can come to know without over longer number of period of samples. So how long this process is been in practice, I wanted to know.
So this has been practiced since around 2.5 years. We developed it. I would say we started the development around 4 years back, but with validation and everything, it's been 2 years that it's in the field. But the degradation of patient has nothing to do with what we have done. What we are trying to do here, ma'am, is that we are just trying to identify bad machines, which is making noise, which is not letting the patient sleep at night while the dialysis is happening. The quality of what you asked, I believe, is the life of the patient, right? Over time, they lose their kidney function, they lose their vitality, and eventually they die, right? So that happens, it's because of the biological process. Many patients are able to live on dialysis for 12 years, 18 years, and some patients die also on a very, you can say, only after a couple of months into treatments, right? So this does not help the patient's health directly. It only helps to have quiet dialysis treatment at night, so that the patient can sleep well. Apart from that, the exchange of the fluids and everything, which I'm showing here, has been happening for ages. So this, the patient is able to do unless and until their peritoneum is able to do this reverse osmosis semi-permeable action for a long time. Once the patients are very old, then they have to go to the hemodialysis treatment. And at some point in time, their body cannot take it. They are pretty old, and unfortunately, they die after some years. So this only helps you sleep well, and helps us to know that which machines are going bad in the field, and we can swap it out. And ideally, what we do is we have 2 years where we deploy the machine and we always swap it out. But sometimes when we have, as I told you, we do not only sell new machines to the patients, right? We also deploy a second-hand machine, as we will call it in India, right? We get the machine back, we refurbish it with the new compressors and motors, and we send it back. So sometimes in 6 months, because of you always have bad production practices. Sometimes this tells us that hey, this machine is going to go bad, so swap it out, right? So that swapping can happen from 0 to 2 years. But at 2 year mark, we always swap the machine for sure. Does it make sense, ma'am?
Yeah, sure.
Yeah. Anyone, if you have any questions on the slides, I'm happy to answer.
Yes, Dr. Rohit, you can unmute yourself and ask.
Yes, means I have a question.
Yes, ma'am.
Like what kind of analysis? What kind of analysis means this machine will be help? Like this is the only I see. This is the only you use the ML to identify the machine. So how is benefit for the patient? Because you are looking for only your means thing. Patient will be doing the same process. There is
Correct.
no means. So what is benefit for the patient? Like this tool, if we use AI to means improve the, like I see the improvement of the device only. There is no improvement in the patient side.
Correct.
Then
Correct. So
patient
that's
will
a
go
great
for the
question.
same.
Yeah, go on, Rohit. Sorry to break you. Please go on. Yeah.
Yeah, means so means patient have to go like these are 3 hours process. Suppose like then there will be 3 hours. There is no difference over there. Only you identify this machine is good or bad. This is your objective, which I see that. So
Correct.
like how means this AI can be help the patient or the doctor if we introduce this thing in this kind of means practices.
Correct. No, that's a great question, and I can answer that. So you're right. Right now, we are not. This our objective is, of course, to make the patient's life better. The objective is not that we identify bad machines, because even if we don't identify bad machines, what will happen is that somewhere, say, you are in Wolfsburg, as I understand, Rohit, right? Somebody is in
Yes.
Frankfurt or in Stuttgart. They would just give us a call in Fresenius Schweinfurt facility that, hey, I'm Rohit. My machine is making a lot of noise. Can you please replace it? So we have our entire supply chain from Europe to America, everywhere to Japan. Somebody will come next day on your door and will give you a new machine and take your bad machine back, right? And the reason is that Rohit called and said that, hey, this machine is making a lot of noise. I cannot sleep at night. I start the machine. I have to do dialysis because my kidneys are not working. But in the morning, I wake up very lethargic. And then if you have not slept the entire night, right? And you have to drive, say, on Autobahn without speed limit, right? Amazing. So if you go out there, you may have an accident and you may die. Or you go to work, even in your bus and everything, if you have not slept the whole night very well because of the noise, you cannot function properly, right? So the main thing is about sleep. If you don't sleep well at night, you won't be able to function well the next day. So what the patient will do, if this peritoneal dialysis is very noisy for them, then the other option in the world is hemodialysis, where he has to go to a clinic, right? And do a fistula surgery on their to connect their veins and their arteries, and go every 2 days for 4 hours and get the dialysis done. They cannot do it at home because of noise. So what we are trying to do is that if we can predict that this machine's motors and compressors are going to make noise and will not let Rohit sleep at night, then we would proactively, we know that the machine is going to now make noise in 15 days. So before that 15-day come, where the noise of the motor and compressor becomes so loud that you start hearing every day at night, right? The whole 8 hours and cannot sleep, we come proactively at your doorstep and say, hey, Rohit, our models told us, our machine analysis told us that your machine is going to start making noise. And Rohit will say that, no, I'm able to sleep nicely. Why are you saying that? But we say that, no, we have a policy. So we will take your machine. Please give us your machine and take this new one. And then next day you are using the new machine, which is also not making noise. So that noise factor is what we are trying to do. That you have to do dialysis. You will take 8 hours for what I'm showing you right now to push the water inside and push the dialysate out. That is going to happen. We cannot help you in that. We cannot reduce it to 3 hours. We cannot reduce it to 4 hours, right? That is a biological process, which we have to do it as per your heartbeats, as per the amount of reverse osmosis which needs to happen. So we cannot reduce that 8 hours to 8 minutes. That is right now not possible at this point in time. What we are doing is that this process, we want to make it as disruptive for your normal life as possible. Correct? Because right now, when our kidneys are working, we switch on our heater or we switch on our air conditioning and we go to sleep, no problem. But if that machine which is doing dialysis wakes you up every 3 hours or 4 hours of time, right? You will not have good quality of sleep, which will affect you in your work life, and eventually, with continuously having to deal with this lack of sleep, your health will deteriorate. So that is what we are trying to do. That does make sense, Rohit?
Yes, 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 yes.
Yeah. So it is basically we want you to sleep like a baby. We cannot unfortunately help you to have a better dialysis. Yeah. Right now
But
you will have to
means,
spend 8 hours. Yeah. Go ahead.
yeah, but yeah. So you try to means reduce the noise actually. Yeah.
Exactly. We are trying to reduce the noise and we are not trying to reduce the noise again. Noises will happen. We are trying to predict that this machine is now going to make more noise. So before it does, we
Yeah,
stop.
and means then I have one top of that means if my machine is making the noise,
Mhm.
then you guys means tell me like means your machine you have to change the machine. Then who
Correct.
will be pay? Like I'm the patient, then I have to pay, or means someone else have to
No.
pay, or your company will be take that.
Correct. No, we take the expense. I think in the beginning I told you that we have the business model is different for hemodialysis and peritoneal dialysis. So in
Yeah, yeah,
hemodialysis, we sell the machine and bloodlines to different clinics, and Fresenius have their own clinics in Germany, in France, in America. But in peritoneal dialysis, you only buy the bloodlines and the dialysate. You don't buy machine at all. The machine is free from the company. So everywhere in Germany or in the US, in the world, nobody from Fresenius, we never sell our machines. We just sell our services. Does it make sense? So what we do
yes,
is it's a service model. So if your machine is bad, you don't have to worry. It's like leasing a car, right? So leasing a car, or if you buy a Gebrauchswagen in say in Germany, in Gebrauchswagen you buy a used car and it is your car. Then whatever happens, you have to change the spare parts. But if you lease a car for 3 years, right, with say 20,000 kilometers, if the car goes bad, you go to Audi or VW and say, hey, take the car back. It's your problem. They will give you a new car. It is exactly the same. Machine goes bad, Fresenius has to change it, and we take care of it. You don't have to worry about it. Yeah. So patient is not losing anything in this.
yeah, yeah,
Make sense? Yeah.
One of
yes.
the participant, Dr. Senthil Kumar, wants to ask, sir, can you unmute yourself? Senthil Kumar? Sir posted few questions in the chat box.
Can I go to the chat box out here? Give me a second.
How to increase the bag solution for patient 2 to 3 or 4 bags per day?
How to increase bag solution for patients into 3 or 4 bags per day? What is the solution inside the bag? So inside the bag, central sir is nothing but a dialysate fluid, which is a mixture of sodium bicarbonate, and it is as per the prescription from the doctor. So it is majority is water and a little bit of salts inside, in simple words. And this we sell them. Even Baxter sells it. You are right. Baxter has another solution called EMIA, and they are also in this field in the real world. Fresenius is a market leader in hemodialysis, while Baxter is in peritoneal dialysis, right? So they also have a similar machine called Amelia in North America, and they also have a similar what do you call mechanism. The peritoneal dialysis mechanism does not change. Baxter has their own machines; they have their own models, which we don't know of because it's IT for them, and we have our own. Yeah. And what is special? Baxter solution contain what type of solution? What are special inside the solution? So as I said, there is nothing special. Even in Baxter solution, the solution is not something special. It is just water and some salts. Even when you are doing hemodialysis, it is nothing but it is salt and water, which becomes what we call dialysate solution, and it is going through a dialyzer on one side of the tube, and the other side is your blood. So solutions is not something very special. It's very easy to create the solution at home also, but we don't do that because we have to have a very automated and very, I would say, I mean, any pathogen-free environment. So that happens in a very clean room, ISO 8 environment where even humans cannot go. To be honest, I cannot go because I have a beard. I'm not even allowed inside, even though I can wear a beard guard. I cannot go when the process is running for creating dialyzers in our factory. It's only I'm only allowed because of the beard and the hairs I have on my body. I'm only allowed when it is out of production. So that solution making is nothing innovative. It is just water and salts, and they are combined in a special concentration way by all companies around the world. Another question he has: why PD patients and HB level is reducing after 3 months? Any special reason? You can ask. This is something it's outside. Although my last name is Doctor, I'm not a medical doctor, as you know, right? I'm not the kind of doctor who can help you with this. But with the PD patients, the HB levels are should not reduce according to me, because in PD you don't take the blood out from the belly, right? What you're taking out is nothing but your dialysate. Dialysate goes in, dialysate comes out. What is the other reason why the HB level reduces? There is no loss of blood in PD patient. Although in hemodialysis treatment, there is sometimes loss of blood. If there are some issues with the membranes, a faulty membrane, there could be complete transmembrane pressure created, and you may have some sort of a blood leak inside the blood dialyzer, and the machine will be able to detect it and stop the treatment, and the machine or the dialyzer will have to be swapped out. But over course of time, why HB levels reduce? There are multiple factors, and it is very subjective to patients. Any other questions you have, Dr. Senthil Kumar? Yeah, thank you. Please let me know.
I think no other questions. Participant, do you have any questions, queries? If no, sir, I want to take screen sharing rights. Can I take?
Yeah, sure, definitely. I will stop sharing right now. Definitely. Yeah, go ahead.
Thank you very much for very informative session.
My
Participants
pleasure.
really engaged during the session. As a gesture of gratitude and respect, we present you the e-memento for this. So I request you to please accept it. And thank you very much, sir, for being with us for this Atal 1 week faculty development program.
No, I really appreciate Chaya ma'am. Thank you very much, and
Yeah.
thank you, Chirag sir. If any participants feel any suggestions from what we have, what I presented, feel free to reach out to me. Very good questions from Rohit. If you feel anything is different and you think something can be changed, please feel free to take my email ID. I can share my email ID on the screen right now. Yeah, as someone is asking me.
I
And
request all the sorry to interrupt, sir.
yeah,
I request all the participants to please turn on the camera to have a group photograph with the Dr. Akbar, sir. Sir, please continue, sir.
yeah, no worries. Yeah. So I'm just putting my email ID on the chat. Please feel free to send me any suggestions or any questions you have, and it can be maybe beneficial for us to make our model better. Yeah, thank you. I mean, that's all I have from my side, everyone. Thank you once again.
Thank you very much, sir. So,
Yeah, is
participants,
group photo done?
yes, sir, done.
Okay. Thank you, Akbar, for
Thank
joining
you,
us.
sir. Thank you very much, sir, for having me. I appreciate that.
It's our pleasure, Akbar.
Yeah, my pleasure too. Yeah. Please, sir,
So,
let me know if you have any changes or any suggestions. I'm looking forward to that. Yeah.
I just wanted to have information to the participant that